Tampa Fox 13. Around 350,000 women in the United States are walking around right now with a genetic marker that makes them at high risk of getting breast cancer. A new program at Baker Street Joseph's Women's Hospital aims at finding these women before they develop cancer and offering them preventative treatment. Whitney Payne works in marketing at Baker, a relatively new job for her and one that has special meaning. "It's nice to be doing something for the company that saved me." Whitney was 25 years old when she felt a lump in her breast. Her doctor sent her to Baker breast surgeon Dr. Robert Gibordi. Most 25-year-olds are not getting mammograms unless they have a strong family history or a known genetic mutation, he offered. Whitney didn't have a strong family history, so she thought. "My aunt had breast cancer when she was 45. Looking back now, that's very young, but I was never that concerned with it." After Dr. Gibordi recommended genetic testing, Payne found out not only is she BCRA1 positive, which makes her high risk for a reoccurrence of breast cancer and ovarian cancer, but she found out her father was the BCRA1 carrier. "I had a double mastectomy because of the gene. Because I'm at high risk of a reoccurrence of breast cancer, so lumpectomy wasn't an option for me." While genetic testing isn't new, there are new mutations doctors look for now. Some of the newer genes, particularly when we're discussing breast cancer, are ATM, CHEK2, PALB2. These all have different risks for breast cancer and different risks for other types of cancer, Dr. Gibordi explained. Baker supported Drive Gibordi's advanced genetic training. Newly diagnosed patients use the genetic information for treatment options. Then the relatives can get counseling to determine the breast cancer risk and receive preventative treatment, so they can make a decision on how to be followed. Dr. Gibordi continued. Typically that's with 3D mammograms and an MRI alternating every 6 months as part of our high-risk screening protocol. Whitney is now an advocate for women on the advantages of genetic testing. Since she knows she's at high risk of ovarian cancer, she can take her own proactive approach. "We have blood work I do every 2 months monitoring for breast and ovarian cancer. And, before I'm 35 or after I've had my kids, it's recommended I have my ovaries removed." Another service Baker now offers is pre-testing counseling. That helps determine what type of risk a patient might have and how important genetic counseling would be for her or him. The doctor says, in most cases, insurance will pay for the testing and treatment. Making strides. The Fox 13 Care Force is teaming up with the American Cancer Society to make strides against breast cancer, and you can join in. The upcoming Making Strides kickoff parties will help participants form teams for the walks and become successful leaders. Here's what you need to know to make your reservation ahead of the kickoff. Parshas Pinellas kickoff August 17th, Vinoy Golf Club, 6 p.m. Reservation. Making Strides Walk, Org Pinellas Hillsborough kickoff August 24th, Strauss Center, 6 p.m. Reservation. Making Strides Walk, Org Tampaf Pasco kickoff August 24th, Hilton Gardens in Suncoast Parkway, Lutz, 6 p.m. Reservation. Making Strides Walk, Org Pascal Polk kickoff August 29th, Lakeland TV Studio B, 202 North Massachusetts Avenue, 6 p.m. Reservation. Making Strides Walk, Org Pocold. Making Strides Walks take place in October, which is Breast Cancer Awareness Month. Join Fox 13's Linda Hurtado, Chris Cato, and Ken Suarez at participating events. Pinellas Saturday, October 14th, Vinoy Park, Walk 9 a.m. Pasco Saturday, October 14th, The Shops at Wiregrass, Walk 9 a.m. Polk Saturday, October 14th, Polk Lake Mirror, Walk 9 a.m. Hillsborough Saturday, October 28th, Amalia Arena, Walk 9 a.m. Link for more information about Making Strides events near you.